Hello, everyone. The Association of American Medical Colleges is pleased to welcome you to today's webinar on optimal strategies for your residency application with a focus on general surgery. We are recording and will make the archive available afterwards, and we will email you when it's posted. We have muted all participant audio. If you need help, please send us a message. This presentation includes time for Q&A. You may submit a question at any time by clicking the Q&A button at the bottom of your screen. To access the resources, including the slides, please click on the Handouts tab where you logged in today. It is now my pleasure to welcome Cynthia Hutchinson to begin.
Thank you so much, Jill. Hello and welcome, everybody. We are so excited that you're here for the Specialty Spotlight webinar on general surgery. My name is Cynthia Hutchinson, and I am a Director of Engagement for Residency Programs here at the AAMC. To begin today's webinar, I wanted to take a moment to give a little background on how this series came together. Each year, we hear from applicants, advisors, and programs that there's tremendous value in having a shared space to talk about the unique aspects of applying to different specialties. To help meet that need, the AAMC launched the Specialty Spotlight series in partnership with specialty organizations, advisors, and program leaders. These webinars are designed to offer clear, specialty-specific guidance straight from our experts so applicants can approach the process feeling more confident and informed. We see ARIS as a connector in the residency ecosystem, and this series is one of the ways we help bridge perspectives between applicants, medical schools, and residency programs. Whether you're hearing about general surgery for the first time or are already on your way to applying, we hope today's session provides meaningful insight and support. We are thrilled to have you with us and excited to hear from today's speakers as they share their expertise on preparing for a career in general surgery. This recorded webinar includes a brief overview of the AAMC and updates pertinent to applicants for a given field. So for today, general surgery. After AAMC and ARIS updates, I will pass it off to our wonderful experts in the field of general surgery. Joining us today for the advisor perspective is Dr. Katie Stanton-Maxey. Dr. Stanton is an associate professor at Indiana University School of Medicine and the director of the Department of Surgery's undergraduate medical education programs at UI School of Medicine. Following the advisor perspective will be Dr. June Shim for the program director perspective. Dr. Shim is program director of the General Surgery Residency Program and a bariatrics advanced minimally invasive surgery surgeon at Bassett Healthcare Network. Thank you, Dr. Stanton and Shim, for sharing your perspectives and advice today. We will conclude the webinar with a discussion that begins with some questions we received at time of registration and then move on to questions asked during the webinar. The Q&A feature is open, and we do have folks ready to answer your questions throughout the webinar. We likely won't be able to get to all questions that have been previously posed or submitted today, but we are doing our best to answer as many as we can. We will also be providing helpful links and a copy of the slides used today along with a recorded webinar. Feel free to refer back to this material once it is posted. Many of you have likely heard of the AAMC, but I wanted to provide a moment to introduce just a few facets of the programs and support we provide the academic medicine community before moving on to my ARIS updates for the upcoming cycle. The AAMC is a nonprofit association created to lead and serve the academic medicine community since our founding in 1876. Our mission is to improve the health of people everywhere. This is why our association supports over 450,000 members of the community, from medical students to program leadership to deans and DIOs. More recently, it's important to point out that the AAMC is leading efforts to fight against NIH funding cuts, so to protect the valuable research and education these funds provide in service to patients everywhere. AAMC, through the integration of ARIS and other partnership data, supports applicants' journey through the transition to residency. It's not simply a transactional step, but rather part of an overall offering through the AAMC and others. And we are focused on strengthening the support to applicants, programs, institutions, and specialties. ARIS was built by and accountable to the whole community. These products were not built in isolation. All recent updates to MyAris came from stakeholder input, feedback, and research, including 40+ working group meetings and input from thousands from surveys, one-on-one meetings, and focus groups. The same approach is used to develop other services around ARIS, including the Dean's Office Workstation and Residency Explorer tool. I'd like to take a moment to highlight one exceptional tool offered by the AAMC Residency Explorer tool. We've dropped the link in the chat for you, and I would like to highlight this highly utilized tool for applicants and advisors to compare program offerings and to assess competitiveness in order to form program lists for sending in applications. The AAMC's Admission and Selection Research and Development team is innovating the tool based on research and community feedback. Based on your valuable feedback, the Residency Explorer tool has expanded data this year, including increased specialty coverage from 25 to 40+ specialties to provide broader insights across more fields. The integration of the NBME and NBOME licensure score information, including program level Step 2 CK and Level 2 CE score ranges for applicants invited to interview. There's also more detailed NRMP program position data showing total positions offered and filled by all residency position types, and coming in August, enhanced program-specific details, including application process information and updated license exam requirements. Before we move on to updates, let's review the timeline for the upcoming cycle. The 2026 recruitment season officially began in June for July cycle fellowships and will continue through the NRMP main residency match week in March. Let's take a look at some important dates for students that fall between these milestone dates. First and foremost, we have that August refresh that's coming from Residency Explorer, so stay tuned for that. And then on August 20th, this is the last day for programs to opt out of program signals. So if you're looking at program signal status after this date, you can be assured the information is accurate for planning out your signal strategy. On September 3rd, you can begin submitting applications and associated signals to program. So take that time between August 20th and September 3rd to double check signal status before submitting applications. On September 24th, programs can begin reviewing applications. Now, we all know what occurs after that, lots of interviews and decisions being made, and we at the AAMC wish you all the best of luck during this process. We will now move on to important updates for general surgery applicants for the 2026 ARIS cycle. First, let's start with the program signal participation and what that means for general surgery applicants. During the 2026 ARIS cycle, applicants will have 15 program signals to use. This is the same number as last year's applicants. Once you submit your application with a signal, the signal cannot be taken back. It is permanent. Again, we recommend double checking program signal status after August 20th and before you begin to submit your applications on September 3rd to assure each signal is used in a productive way. As a reminder, program signals are a way for applicants to show true interest at time of application. For this reason, the AAMC recommends signaling all programs for which you have true interest, including home programs and programs to which you rotated for an away or audition rotation. An upcoming update to the MyAris application that all users will see, regardless of specialty to which they are applying, is the interruptions or extensions section of the application. If you have no interruptions or extensions, simply click No for each of the 2 questions on this page. If you've had an extension or gap for academic or professional reasons, you may need to answer one or both questions based on your unique situation. The first question is identifying if an extension or a gap was academic, meaning it was related to repeated or remediated coursework. If the answer is yes, select that response, and a text box will appear for you to provide a short explanation. The second question is regarding an extension, leave, gap, or break due to a professionalism sanction or other adverse action. If the answer is yes to this question, select that response and provide a short explanation in the text box that will appear. Please note that neither of these questions are intended to solicit information about your health, disability, or family status. As such, if you have a question about how to answer either or both questions, we recommend meeting with your academic advisor to complete this section as accurately as possible. Last but not least, there is a wealth of resources available on the AAMC website. Feel free to snap a photo of the slide so you have the QR codes for reference later, or feel free to peruse our site anytime for more information. I will now pass off to Dr. Katie Stanton Maxey for the student advisor perspective.
Hi, good afternoon, everyone. My name is Katie Stanton Maxey. I am an acute care surgeon in Indianapolis, Indiana, and happily lead all of the undergraduate surgery education for IU School of Medicine. Next slide, please. It's important to consider some things before officially starting your application in the ARIS system. A great place to start is updating your curriculum vitae or your academic resume. This will be really helpful in planning what experiences you're going to be selecting to include in your official application. Many of the surgeons who are writing your letters of recommendation are going to ask for your CV as assistance in preparing your letter. So this is a great thing to have updated as early on as you possibly can. You'll want to reflect on your experiences. Think about how the experiences may come together in certain themes that reflect on your interests and specific values. You'll be asked a lot over the course of the application process why you're interested in general surgery, so it's helpful to really be deliberate and thoughtful in constructing an answer to that question. Additionally, thinking about what your future practice looks like. And you may not know exactly what this will entail, but it's good to be thinking about your interests in terms of whether you are considering ultimately pursuing practice in a community setting or in an academic institution, what patient population you're most interested in caring for. These are some of the things that hopefully you can really put together some thoughts about your future. You'll organize all of these themes from your CV, from your personal experiences, including influential patient encounters, and really be thinking about what strengths you are going to bring to the specialty and the programs that you're applying to. Next slide. Preparing your application in ARIS is going to be assisted greatly by utilizing the application worksheet that you can access with this QR code. You'll be asked all of the things that you're going to include into the ARIS application. You can take some time with that by using the worksheet to really organize your thoughts and experiences. These are experiences that ultimately reflect on your core values, your interests. You'll want to think about those that have demonstrated a commitment to something over time, or perhaps have been leadership experiences. While having experiences related to your specialty of choice is helpful, it's certainly not required. And experiences unrelated to general surgery often have a lot of value in demonstrating or representing yourself as a really well-rounded candidate. You'll be asked about these experiences in interviews, and so you'll want to be thinking about how ultimately you're going to talk about these experiences. You'll have to then choose 10 experiences to focus on for your ARIS application. You can consider grouping related things if you have to narrow down to get to that number of 10. For instance, if you've done multiple projects with the same investigator, you could consider grouping those together as one experiences, highlighting the ways in which you participated in specific projects within that experience. You'll be asked to choose the 3 most meaningful experiences. You'll reiterate not just the details of your work on those projects or experiences, but more why they were so meaningful to you and how they've contributed or demonstrate your specific character traits and values. Ultimately, reviewing this list with a trusted advisor is really helpful in organizing your thoughts, getting feedback about how you can best represent yourself as a candidate in your ARIS application. Next slide, please. As you are developing your application or putting those details into the ARIS system, you'll be simultaneously developing your program list. You're going to want to think about what factors are the most important to you in choosing a training program. Every program list is unique as the student who is creating it, as your various interests and priorities are going to be very unique to you. I highly recommend utilizing the residency preference exercise you can find on the Careers in Medicine website from AAMC. This will review lots of various factors and help you to prioritize things like educational and clinical duties, work environment, faculty and resident interactions, things like compensation and benefits, quality of life, work balance, and other things as well. It's important to consider your candidacy as an applicant and really focus on targeting programs that are appropriately tiered for your application. There are some great resources to help you in this determination, specifically the Residency Explorer tool that's been mentioned previously, that's getting a great update here very soon, is going to help applicants really compare themselves to those who have matriculated at the specific programs that you're investigating. Next slide, please. As you develop and refine this list, you're going to want to look at specifics. Look at the program's specific websites, get a feel for their mission, their values. It's also helpful to review the match trends from your institution and find out how students who have pursued your specialty have fared in the match process and what programs are common for matriculation. If you can, talk with former students and alumni, especially at programs that you are very interested in. As you draft a tentative list, you're going to want to get input from knowledgeable advisors at your school, those who can really help you comb through the list that you've put together, determine the best length, how many programs you should apply to, if there are any programs that may be a little out of reach or may not specifically align with the goals that you have put together. And as you do that, you'll want to be considering what 15 programs you will choose to assign your signals to. Getting advice on this is also really critical. You want to ensure that you have utilized those 15 signals in the best way possible, really prioritizing your interests and values and also aligning well with your level of competitiveness. Next slide. As we drill down a little bit more and think about specific factors to consider, think about the type of program that you're targeting. Again, do you want to pursue academic study or practice in the future? You may be most aligned with an academic institution or one that is academic affiliated. Alternatively, you may be more interested in pursuing a direct path to general surgery practice in the community, and therefore an independent or community-based program may be best aligned for you. Consider rural programs and how those might be aligned with specific goals for your ultimate practice needs. Considering the age of the program, their accreditation status is very helpful. I know this is accessible within the ARIS system. Newer programs may offer a lot of great, exciting opportunities, but may not be as well structured or time tested. Those are going to be things that, again, may be specific to what you're prioritizing in terms of your educational or training experience. Lots of other individual factors certainly include geography and community of the training program, its size, curricular offerings. Some programs may have very well developed and protected educational experiences like didactics, skills, or simulation exercises. You'll want to consider, as I said before, the patient populations you'll be interacting with and how those are priorities for you. Multiple clinical sites may offer a lot of different opportunities to interact with different kinds of patients and populations, but may come with logistical challenges as well. Faculty and resident interaction, resident life and wellness, those work-life issues. It's important to determine where those prioritize for you personally. What professional development opportunities are available? Are there fellowship training programs at a specific institution? That might be important to you specifically related to your future practice goals. It may also have an impact on your training experience as a resident. And finally, again, looking at career paths for alumni from specific programs can help to give you an idea about the program itself and how well they can position you for your future practice. Reviewing your application is really important to be prepared to discuss all of your experiences in the interview. Additionally, you're going to want to consider formative clinical experiences, patient encounters that really help to demonstrate your values and characteristics that you are going to be bringing to that program should they choose to match you. There are a lot of resources for interview preparation, including a few on the AAMC Career in Medicine website has an interview prep under Prepare for Residency. There's also a preparation guide that speaks specifically to virtual interview preparation. Additionally, many schools offer a lot of resources for this, including mock interviews, which are certainly intimidating, but can be incredibly useful in terms of helping you to be prepared and to be comfortable in the interview situation. Reviewing the program's website prior to an interview is really critical. This will help you to be prepared to answer some very standard questions, including why are you interested in our program specifically? And the really common question of what questions do you have for me about our program? Preparing questions can be really helpful and asking about things that may not be readily available on the website. Ultimately, learning a little bit about the city and the community can be helpful for your interview experience as well. Practicing is important and utilizing any tools that are available to you to get ready can, again, make it a much better experience for you. Next slide. For any of the advisors that are with us today, I want to point out a couple of important points. Downloading the ARIS application worksheet, sharing that widely and promoting its use with your students. For yourself, creating a Practice My ARIS account now that the season has opened can be really useful. Familiarizing yourself with the tools that your students will be using, like Residency Explorer. Connecting students with real-time info, such as webinars like this. Meeting with students individually is really critical, again, because their interests and priorities are very unique. It's incredibly helpful to discuss with them specifically their application, their program list, signal lists, etc. And finally, tracking them throughout the application process, looking at interview progress, timing, number of invitations is really helpful. Last slide. Finally, here are just a few resources that can be helpful for learning more about general surgery meetings and other opportunities. There is a lot of match data available on the NRMP's website, meeting information at the American College of Surgeons website, along with additional resources they have for medical students, and finally, other surgical conferences that may be great opportunities to network and meet with other folks applying to general surgery, as well as program directors and faculty at institutions you may be interested in. Thank you, and I look forward to question and answer time. We're going to now move on to Dr. Shim, our program director.
Hi, everybody. Good afternoon. I'm off video because I'm using my iPhone, but after I'm done with my presentation, I'll make sure I'm on video so I can see you all. With that said, it's such a privilege to be asked to give this talk. I'm going to make it as fast as possible so we have enough time for a Q&A. This is my 6th year as a program director at Bassett Healthcare Network, and it's sort of a crossroads for a lot of you guys because you're starting your 4th year and now you have to really sort of seek a program that fits and aligns with your values. And that's really my gist for you in my talk. Next slide. So APDS is committed to, first of all, providing a forum for the exchange of information and, of course, the discussion regarding postgraduate surgical education. We maintain a high standard of surgical residency training to make sure we improve graduate surgical education and patient care. And APDS provides advice, assistance, and support to program directors on matters pertaining to surgical education and, of course, accreditation. And we encourage research into all aspects of education and training. And of course, we represent the interests of all program directors in education and training of high quality surgeons. Next slide. So I just want to share with you this 2025 ERAS cycle applicant volume. You can see that in 2025, we had over 5,600 applicants. And you can see on the bottom how many positions were offered and how many positions were filled and at what status, MD senior versus an MD grad, as listed there. It's important to note that there are over 350 training programs in the United States and those positions offered. Next slide. So if you look at this, what's interesting is we're using information as of December 2nd, 2024, and you can see the N equals regarding MDs, DOs, and IMGs. And what you should really get out of this is that you should signal if you can. And you're given 15 signals for this application cycle, and it would be advantageous for you to signal during this application process. Next slide. So 92% of general surgery applicants agreed that program signals reflected their true preference at the time of application, and that geographic preference-wise, 94% of general surgery applicants agreed that their geographic preference reflected their true preference at the time of application. Next slide. So the survey, again, the top 5 reasons that sort of affected decisions to signal, what we heard is geographic location, alignment of the program strength with career interest, the chance of matching, chance of interview offer, and is this a good fit? Next slide. So I think the big takeaway from this is what are the components? I think there was one person who asked, what else are programs looking for? And I think what you should sort of look at is the STEP exams are important as illustrated here, as well as letters of recommendation. But I think when I was talking about it as a group, what was interesting is that, people talk about research all the time. Look at the third bottom, number of all publications. It's not very important. So don't stress if you don't have a lot of publications. You can see that the personal statements, please look at the attention of medical education, training, interruption, or extension. That does matter, as you could see at 41%. And then, of course, the clerkship transcripts, and then the above. But this sort of highlights some of the things that medical students worry about and why it's not as important as you may think. Next slide. Now, I think the most important thing that I want to sort of share with you as a program director is seek the program that aligns with your values. How do you learn? You have to have some reflection about this before you apply. What's the kind of culture of teaching and feedback that you need? What is the resident support? Fine, I've matched, but what kind of support am I going to get? How does a program handle failure or struggle? We all struggle. There is not a single surgeon that did not struggle in residency. But how will that program handle that? How do you choose between a community program versus academic? I'm going to go a little bit more granular in my next slides. And how does this align with my goals, my learning style, and my long-term career plan as a surgeon? Next slide. So, with academic programs, research, there's subspecialty fellowships. You guys know this: academic leadership, high volume, complex cases, multiple subspecialties. It's structured, it's competitive. There's cutting edge technology and clinical trials. But some of the trade-offs there might be less autonomy because there's more learners competing for cases and procedures. There are larger resident teams, which means sometimes less continuity of care, and it's more formal culture. Next slide. Community program may have an early operative autonomy, aiming for general surgery practice right out of residency. You know that you want to go back to a community where you grew up. Tight-knit teams, close faculty mentorship, supportive atmosphere, but the trade-off is that there's less access to sort of that rare or highly complex cases, fewer research opportunities, or even a fellowship pipeline, given that that program doesn't have one, and fewer residents, which could mean more calls or responsibilities. Next slide. What about rural programs for those who are interested in rural? Are you drawn to broad-based training where you learn to handle, quote, everything? Do you want to serve in an underserved or resource-limited setting? Do you appreciate independence and hands-on learning? And do you want that autonomy and tight-knit community? The trade-off, again, is limited subspecialty exposure, for example, transplant. You may require more self-direction in learning. And fellowship opportunities may require you to do some more external networking. Next slide. So these are the recommendations by the APDS when it comes to the application review. First of all, holistic application review is strongly recommended. Transparency relating to the values and characteristics is strongly encouraged. Step 1 and COMLEX Level 1 numerical scores should be de-emphasized in the 2025-26 application cycle, and that applicants and their scores should be considered within the context of a holistic review. And the program should disclose how those scores will be considered. We also encourage all programs to consider the COMLEX and USMLE exams when engaging in holistic review, and to offer transparency about their policies and expectations about these exams. In fact, there's a link where they can compare COMLEX percentage to USMLE to help and support program directors as they do their holistic review. Next slide. So first of all, general surgery programs should not offer their first round of interviews prior to Wednesday, October 22nd this year. The first round of offers will be sent between October 22nd and October 31st. Programs should provide transparency to applicants if making interviews offers outside of this window, and should give a minimum of 48 hours for the candidate to respond. And programs should only send the number of interview invitations for which there are available interview slots, and disclose the expectations about interview, offer response, and cancellation policies. And that we recognize that the AAMC has advocated for virtual interviews to provide equity, cost savings, and reduced environmental impact, but that we recommend that each program, in consultation with their GMAC, identify their values and best practices when choosing the interview format. So it's really personalized to each program. Next slide. I also want to share about AI. We acknowledge as program directors in general surgery that you may utilize AI platforms in the process of the application review. This may include document review, coalition, and other review mechanisms, and that we strongly recommend that all programs, again, be transparent in their use of AI. We also recommend the interview methods adhere to the following best practices: equitable opportunities to all applicants, uniformity of the evaluation process, transparency, and mitigation to prevent bias. Next slide. When it comes to signaling, we recommend that applicants utilize their 15 signals to indicate their top 15 programs. We recommend that applicants signal home institutions, OA rotations, or addition rotations that fall within their top 15 preferred programs. That is, these experiences should not count as additional signals. We also acknowledge that applicants utilize resources that are available to them. These may include peers, advisors, and AI tools. So we strongly recommend that all materials be the applicant's original work that reflect honest and accurate information. Work not original to the applicant must be properly cited. Next slide. So this is a slide just telling you register for the APDS Recruitment Recommendations webinar on Monday, August 4th at 7 o'clock Eastern Time Zone. Next slide. And these are some data sources and helpful links that you may want to utilize for this application cycle. Next slide.
Wonderful. Again, thank you so much, Dr. Stanton Maxey and Dr. Shem, for joining us today and sharing your insights. We will now move on to the question and answer portion of today's time together. We have about 20 minutes to answer both the pre-submitted and live questions. So please keep those live questions coming in, folks. To begin, we'll start with the pre-registration questions. The first question is, what are the top qualities that general surgery residencies are looking for in applicants? And this is such a great question for folks to be listening to. I will start with Dr. Shem and then pass off to Dr. Stanton. What do you think, Dr. Shem?
Well, I can tell you that everyone's brilliant. You came this far, you graduated medical school, you are brilliant, but that's not what I'm looking for. I'm looking for a surgical resident that's coachable, that cares for others, and do things with grace. I think when I think of the top surgical resident, chief residents that have graduated, it's because, and I know this is very basic, they showed resilience and humility. They know how to work under pressure. And to me, that's the program fit for our small program.
Thank you so much, Dr. Shem. What do you think, Dr. Stanton?
I agree. And I think Dr. Shem highlighted a really important point, which is that there is a fit for each and every program and for each and every applicant. And that's where the research and recognizing what you're looking for in a program is really important. And then determining what the programs that you're looking at, what they value as well. I think a lot of things really come back and center around very specific competencies, like professionalism and patient care, communication skills, work ethic, and teamwork, leadership. These are all really common things that I do see really extending across many different programs of many different types.
Wonderful. Thank you so much. We will move on to the next question. How important is research when applying for general surgery, and how should we discuss our research experiences within the application? Dr. Stanton, I will pass this one off to you.
Sure. I think Dr. Shim highlighted well that ultimately, in all of the factors that program directors are considering, the number of publications is really not anywhere near the top of the list. Research experience, I think, is helpful in terms of demonstrating your well-roundedness as a candidate, getting involved in the research process, dedicating your time and energy outside of your required academics to learn more about the scientific process and engage with that is something good to demonstrate. In terms of discussing those on your application, it's really important to be very clear about what your involvement was in specific projects and to be able to discuss the work eloquently. Many of your interviewers will not be familiar with your topic of study and will ask you to explain that. And so being able to do that, I think, is really important.
Wonderful. Anything to add, Dr. Shem?
No, I think Dr. Stanton hit everything on the nail. I would just say that, again, it depends on the program. Some programs really are going to be very detailed when it comes to research. And so I'm going to echo everything she just said. But there are other programs where that is not their top priority. And so I just shared with you, there are over 350 general surgery training programs in the United States. Everyone logged on today will match into general surgery if you do the work, which has to do with the program fit. Is this aligning with my values? Is this what I want in my career? That's the thing you should constantly ask yourself.
Wonderful. Thank you both. Moving on to the next question. Let's talk about common weaknesses seen in general surgery applications and how can one be proactive in addressing them or demonstrating they've overcome them? Dr. Shim, we'll start with you and then pass off to Dr. Stanton.
I think one of the big things when I see people's personal statements, and that's actually the first thing I look at before scores or schools, because I really want to just know you as a human being, is I want you to maintain a positive light to unfortunate situations. We all have them. There's not a single person. But how do you review that and sort of talk about the lessons learned and the growth that you gained from it? That's what I want to see. And a well-written, error-free statement is important because it shows that you're detailed oriented. I do not want you to retell your CV. I can read your CV. What I want you to tell me is your commitment to surgery, and sort of your insight about team mindset. Surgery is a team sport. And I think a lot of program directors, that's really what they're looking for, not individual kind of, I'm by myself, but how am I going to have that team mindset? And how is that highlighted in your application?
Wonderful. Thank you so much. Dr. Stanton.
I agree. Making sure you review your application for any clerical errors is very important. Spelling and grammar are very important. Review what you're submitting, ask someone else to review it, I think is always wonderful advice. Other than that, I think, again, being very specific and clear and accurate in terms of representing your participation in specific projects is important. Making sure when you're listing scholarly work like publications and presentations that you're representing those accurately in terms of what form they are, peer-reviewed or other than published, those kinds of things. Ask for advice if you're unsure about how to list something in those categories.
Wonderful. Thank you guys for that great advice. Moving on to the next question. With regards to parallel plans, what kind of guidance is there for those applying to multiple specialties? Should I consider applying to prelim surgical programs? All right, for this one, Dr. Stanton will keep the spotlight on you, and then we'll flip over to Dr. Shim.
Sure. Many applicants dual apply to general surgery and another field, whether that's another surgical specialty or a medical specialty. I think it's first and foremost really important to recognize that your application should be very distinct and separate for the two specialties that you're applying to, specifically related to your personal statement and your letters of recommendation. Applicants often are concerned about, and there was a question in the Q&A, I think, about how your experiences are going to reflect on your interest in general surgery or the other specialty that you're applying to as well. And I think that being very clear and open about that is important. Students often come to the decision to pursue general surgery later in medical school and have developed other interests along the way, and some of your experiences may reflect that. I think it's helpful to really detail your journey in your personal statement and speak to some of those things. I think is really helpful. In terms of preliminary surgery programs, I do think that this is an important factor to consider, especially for applicants that may have low interview numbers for general surgery. It is really critical that you start considering the potential of applying to preliminary programs within the application cycle, as opposed to just waiting for a potential SOAP process to happen. So adding preliminary surgery positions, even after your original list has been submitted, is okay. And I think that's important to consider. There is definitely variability in how program directors who offer preliminary positions offer interviews for those, usually later in the application cycle. But ultimately, getting advice from someone at your institution who is well-versed in general surgery application process and understands how preliminary surgery positions work into this, I think is very helpful.
Wonderful. Thank you so much, Dr. Shim. What are your thoughts?
Well, it's complex. I think that if you are a student, I'm just going to use an example. I want to pursue neurosurgery. I have 250, awesome research. I'm applying both because I know it's still very competitive. I don't match into neurosurgery. Now I have to scramble for a prelim spot. And I think that's really where I want to answer. You may end up soaping or going to prelim. And that's where you have to sort of, again, I'm big on self-reflection. How did I get there? How did that happen? And do I pivot or do I keep going for another neurosurgery spot? And if I'm pivoting to a general surgery spot, knowing that I tried neurosurgery and you know what, I still love surgery in general, is it going to be okay with me? Then thinking about how to pick a preliminary position is important. Smaller programs may be more personalized where they can help you in July, August. Bigger programs, you may see the program director once, but you may see an associate program director. And I don't know what kind of exposure you're going to have, depending on if you're pivoting to anesthesia or some other subspecialty aside from general surgery. So I'm saying all this to you to tell you that there's a lot of nuance when it comes to the decision of which preliminary position to go, because there's no guarantee. And that's what makes everyone so uneasy, because no one wants to be in that kind of space. So I personally think, of course, a lot of students do dual applications or even 3. But the most important thing is right now in July, having that reflection and saying, okay, why am I doing this? And is my application at its best ready to apply this year? And
Wonderful.
that has to do with introspection, I guess, and reflection.
Absolutely. Thank you guys so much. This is the last question that came through at time of registration, and perhaps my favorite. But we'll start with Dr. Stanton and then move to Dr. Shim. What do you wish you had known at the prospective applicant stage of residency training and trying to find the right program? And what advice would you give your younger self with what you know now?
Yeah, I think reflecting back, I realize how little I understood what general surgery training looked like outside of my own institution where I was a student. And so getting some insight on that and really investigating what other programs looked like and how those were different in terms of rotations and faculty engagement, professional development opportunities. Really, I was kind of narrow-mindedly focused on what I knew. Fortunately, it was very much what I was looking for and ultimately enjoyed about my training experience. And so that certainly worked out. But I think having an open mind and really broadly thinking about what you hope to gain from your training experience and how you best learn, like Dr. Shim has talked about, and what programs have to offer and how that might be different from what you have seen in your own medical school institution, and what, surgery looks like at that place.
Wonderful. Thank you so much. Dr. Shim, what kind of advice would you provide your former younger self?
I guess what I would say to you is be flexible with yourself and the program. There is no perfect program. There's no perfect you. But as long as you try to, again, do the best you can with the information you have at this moment in 2025 and try to align that, hoping for the best. I guess that's what I would tell myself. No one in my family went into surgery. I didn't know the difference between community, academic, or rural. And, I trained at a big institution, and but I'm a program director now at a very small rural program. And having been exposed to both, and I also served in the US Army, and seeing how education is in all these different environments, at the end of the day, it all works out. So just again, focus on what's important to you. How do you want to spend your time, and how do you learn?
Amazing. Thank you so much. We will now move on to the live question portion to close us out today. The first question I have from the audience is in regards to the really great recommendations that were provided today from the APDS regarding recruitment season. Obviously, our folks that have joined us today and those who are going to watch this recording will have the recommendations in this webinar. There's also the August webinar that APDS is putting on, but will there be other locations for the interview season guidance that an applicant can download and keep handy?
I think that as long as you continue to check the APDS website as well as the AAMC, I think that's a really good start. I think that we do our best to communicate as much as possible with webinars and online information, but those are two great starts.
Perfect. Thank you so much. And the website for that is apds.org for those who are looking for that link. All right, moving on to the next question. This is about sub-Is. How are applicants viewed who have only completed a single sub-I at their home institution? Are there additional sub-I experiences that are helpful, that strengthen the application, or are there specific guidelines to the number of away rotations to demonstrate interest in surgery? Dr. Stanton, I'll start with you.
Mm-hmm. I find that general surgery is a little bit different than many of the surgical subspecialties that really rely on and expect audition or away rotations. Like neurosurgery and orthopedic surgery, for examples. Personally, I see maybe about a quarter to a third of the students at my own institution doing away rotations in general surgery. So I know that this is not absolutely necessary. I do think that away rotation can provide some of that knowledge about the way other general surgery programs are run and how things might look a little bit different than your home institution. Certainly they can give you more insight into a very, a particular program that you might be interested in. But you're limited by the time that you have in order to complete those rotations. And I think that program directors are very aware of that. If you have had good, solid experience in seeing general surgery at your home institution and have developed, an interest in pursuing this specialty based on experience, I think that fills that requirement. My point being that, if you have a very limited amount of exposure to general surgery, program directors may be concerned that you don't necessarily know what you're getting into, so to speak. And so at least having, one very good sub-I experience and exposure to surgical training, I think is very important.
Wonderful. Thank you so much. Dr. Shim, do you have anything to add from from the program director perspective?
I think the big thing is if you're going to pursue general surgery, we want to see you doing general surgery rotations. I think that students who only did general surgery as a third year and then maybe do one sub-I, it shows, I guess it questions your commitment to surgery, even though maybe at your medical school, they want you to get a variety of other experiences before you graduate. But the other flip side is you're about to start a job. And the program directors want to know, are you going to be comfortable doing general surgery intern year, which has a very sharp learning curve? And so I think sort of meeting halfway in the middle, making sure you get that experiential learning under your belt before you start your surgical intern year, because it is a job.
Wonderful. Thank you so much. We have time for one more live question. So this one is in regard to fellowship interest. If a applicant is coming in to their general surgery residency recruitment experience with a strong interest in a certain subspecialty, when is it appropriate to mention that strong interest in fellowship training? I'll start with Dr. Shim and then I'll move on to Dr. Stanton.
It depends on the program. I think that if you want, for example, you want to do pediatric surgery and you know that instinctually now early on, probably it's not a good idea to mention that at a smaller community program because it's going to be hard to match from a it's not a complete 0%, but it's harder because there's no research here. It might be a 5-year program. So I think reading the room, having situational awareness about the program you're being interviewed and seeing if it's a tertiary academic center with a pediatric surgery fellowship, of course you could bring that up. That makes a lot of sense. So again, personalizing your approach to the program that you're interviewing is probably your best bet.
Wonderful. Thank you so much. And apologies to those who we couldn't get to your questions. They are all very, very important. We will provide the recording of this presentation after it is concluded, as well as the handouts. I will pass it back to Jill to close us out.
All right, well, thank you, everyone. We do ask that you please give us your feedback on today's presentation by filling out the webinar evaluation that will pop up on your screen when the webinar ends. We have also recorded this session and we will email you when we post the archive. On behalf of the Association of American Medical Colleges, thank you to our speakers and, of course, all of today's participants. Have a wonderful day.